just don't know when a flare-up's gonna happen. And when it does, it just kind of hits you like a bunch of bricks. It's one of those things that you can never really pinpoint. Like, you know it might be coming, but you're not for sure that it's gonna happen.
That was Addison Stretch back in 2016, talking about how living with lupus affects her day-to-day life. Welcome to our In Focus discussion tonight on Lupus Awareness Month. Lupus is a chronic disease that affects the immune system that can cause joint inflammation, fatigue, and even affect internal organs. Tonight, we will hear from someone impacted by the condition, a specialist about treatment, and an activist about what's being done to provide more support to patients. Up first via Zoom is Maddie Anderson, who lives with lupus. Maddie, thank you so much for being here tonight and welcome to the show.
Thank you for having me.
Maddie, let's start our conversation with your diagnosis. When did you start feeling or experiencing symptoms, and how long did it take for the doctors to figure it out?
I started experiencing symptoms when I was about 13. I didn't know that at the time. It wasn't until I was diagnosed 3 years later that I realized that my joint pain and that kind of thing started when I was in 7th grade.
And could you give us a glimpse into your daily life? What is it like living with lupus?
I've had it for 18 years or so, I've gotten pretty used to it. I can mostly live my life fairly normally. Maybe from the outside it doesn't seem like it, but some things are more difficult, exhausting, and uncomfortable because of lupus. But like, I have to limit my sun exposure to almost 0, or else I get very sick. I get really exhausted easily, so I have to kind of decide what I can do and not push myself too hard. The biggest thing is the sun exposure. It's very difficult to not be able to do everything I want to do outside with my friends and family.
That's so interesting, and I'm wondering, do your symptoms change? Do they flare up, or maybe manifest itself differently?
Yes, I go through stages where my symptoms are very minimal and stages where it's so bad that I'm mostly in bed. But even when I'm not in what they call a flare, symptoms do still show up. So if I don't get enough sleep, if I get too much sun exposure, then I will get joint pain. I can start losing my hair when I get stressed out, and the classic butterfly rash.
Now I'm wondering, is there a type of treatment that you're receiving, or is there certain things that you can do to kind of keep your symptoms at bay?
I'm on 4 different medications specifically for lupus. But the thing about lupus is there's no cure, and the medications don't actually really treat the disease, they just treat the symptoms. So right now I'm doing really well on all of those medications, but that could change next month, next week. So that's why I go see my rheumatologist every 3 months.
Now, what's your experience been like sharing your story and what you go through with other people? Do you find that there are people out there who know about lupus or can at least relate to what you go through?
I have found that most people at least know someone who has lupus or have heard that they have lupus. But I have also found that most people don't know anything about it. So I get asked very often what it is. So I explain that a lot. But extended family and friends know about it and are very sensitive to it, and that's been nice.
Maddie, what would you say is the biggest impact or the biggest way that lupus has impacted your life?
It kind of just takes over your life. Starting, in high school, being diagnosed with it when I was 16, it just took over. I didn't get to be a normal teenager. everything has to kind of revolve around it. So though I am doing well right now, I can't forget about it. I have to keep up on it, and I have to take my medication, and I have to do everything I can to keep it at bay.
Maddie, what would you like our viewers or our audience to know about living with lupus that maybe we haven't talked about yet? Or what do you want them to know as they're learning about this condition?
Lupus is often described as an invisible disease because people with lupus often don't look sick. They can look sick, like with the butterfly rash, you can see that, but most people don't know what that is. Or we can lose our hair, but mostly we don't look sick. And so that's kind of maybe the hardest part about it, because people see me and don't just assume that I'm fine because I look fine. And so I think people need to realize that everybody's going through something, not even just people with lupus, but just remember that you don't know what someone is going through.
Well said. That is something we can definitely take away from this conversation. You've been hearing from Maddie Anderson, who is living with lupus. And Maddie, thank you so much for giving us some personal insight into the condition. We appreciate you sharing your story with us.
No problem. Thank you.
We'll be right back with our In Focus discussion on Lupus Awareness Month after the break. Thanks for staying with us for our second In Focus discussion tonight on Lupus Awareness Month. Joining us next via Zoom is Dr. Stephen Call, a rheumatologist who treats people living with lupus. And Dr. Call, thank you for making time for us tonight. We appreciate you joining our conversation.
Thanks for having me, Rosie.
Dr. Call, would you be able to provide us with some data and statistics? I've got so many questions for you, like how many people live with lupus, who has a higher chance of being diagnosed, and typically when in their lives are they diagnosed?
Yeah, good questions. In the state of Utah, I mean, it's estimated that anywhere from conservatively 1,000 people to up to 2,500 people are currently living or diagnosed with lupus. Most of them are women, as you've heard earlier in the telecast. About 8 to 1 are women, and most of them are diagnosed during their childbearing years. So from mid-teens, late teens, up until their early to mid-50s. And certainly diagnoses can come before or after that, but less common. African American, Hispanic, and Asian Americans are more commonly diagnosed or have higher rates of lupus, but it certainly can affect all races and all walks of life.
How interesting. Now, Dr. Call, are the symptoms the same in all people?
No, that's the challenge. No two lupus patients are alike. The symptoms that tend to be the most life-altering and life-limiting for lupus patients, unfortunately, are some of the least specific for its diagnosis. And so that would involve fatigue, sometimes sores in the mouth. These are all common symptoms in other conditions, joint aches and pains or muscle aches and pains. And so people have a variety of those symptoms. Most patients with lupus will have at least those symptoms, but other patients can have more specific signs and symptoms of lupus, including kidney involvement and kidney damage, lung involvement and lung damage, hair loss that's been mentioned earlier, eye inflammation. You can get inflammation around the heart. Virtually any organ system can be involved in lupus. By definition, lupus is a multi-organ system disease, and so it's a very broad spectrum of presentation with patients with lupus. No two patients are alike.
Dr. Call, earlier Maddie mentioned something called the butterfly rash. I have no idea what that is. I'm sure there's a number of viewers that don't either. Can you briefly explain what that is?
Yeah, so the butterfly rash is essentially a rash on the face, and it comes right over the bridge of the nose and involves the cheeks, and characteristically spares this what we call nasolabial fold. It's usually reactive to sunlight, like Maddie has said. So people who go out in the sun, this usually flares up. It usually will last for days and not hours, because sometimes we can get some flushing in the face when we go out, and that's not necessarily a lupus rash or a butterfly rash. And so it gives the form of a butterfly across those cheeks. And that's a very characteristic sign of lupus. It's not the only sign of lupus. In fact, there are many patients, like we've talked about before, who don't have the butterfly rash, but it's a very common one that people can see that give that outward appearance of lupus. And so the word lupus means wolf or wolf mask, is the mask of the wolf is what that butterfly rash was originally described as, and that's how it was named.
There's a reason for the name. Thank you so much for explaining that. I'm wondering, we talked about this earlier, what are some treatments for lupus? What course of action do you normally recommend for someone who's been diagnosed?
Yeah, so the general principles of treatment really revolve around which organ systems are involved. And as a rule, most rheumatologists, in fact, all of the rheumatologists that I know, try to be minimalistic as possible. We want to use the minimum amount of medications to treat the patient and their symptoms. And so sometimes that can range from as little as Tylenol or anti-inflammatories, ranging up to frank chemotherapy and high-dose steroids or glucocorticoids, something called prednisone or Medrol, which we try to limit to temporary treatment because of the side effects. And so we try to balance side effects with efficacy. And there's a whole range of treatments that we have for lupus. Most of them are old. The most recent medication developed for lupus was about 8 years ago. And prior to that, the most novel or the newest medication prior to that was 30 years old. And so this is why we need more awareness for lupus, so we can get more and better treatments for each of the manifestations of lupus.
Yeah, we've made quite some progress, but it just shows that there's still more discovery and research to be done. Dr. Call, we'd like to learn about your clinic. What services do you provide to patients suffering from lupus?
Yeah, so we're a general rheumatology clinic. My father was a rheumatologist before me in the same clinic, and I joined him about 12, 13 years ago. And then my brother joined me. So it's my brother and I as rheumatologists in the clinic. We have two wonderful nurse practitioners as well. And we provide just general rheumatology services for the broad spectrum of rheumatology, but also diagnosis and management of the full range of lupus symptoms. It's a challenge in the state because there's a relative shortage of rheumatologists and a lot of people that need to be evaluated. And so that's why we ask patients who feel like they may have symptoms consistent with lupus to first visit with their primary care physician, who can do some screening tests, and then that will give us a better ability to screen patients and prioritize those who need to be seen more urgently.
Wow, it's a family business. I absolutely love that. Thank you so much for what you, your dad, your brother have done. You've been hearing from Dr. Stephen Call, who practices rheumatology and treats patients with lupus. And Dr. Call, thank you for being a part of this show and helping us better understand this condition.
Thanks for having me, Rosie.
We'll be right back.
A lot of people with lupus have never met someone else with lupus, even though it affects 1.5 million people. So this is not only a day to raise awareness, but sometimes for people to really come out and feel like they're not alone anymore.
That was Noelle Raymond back in 2016 talking about her group's efforts in hosting walks to raise awareness of lupus. Welcome to our third and final In Focus discussion tonight on Lupus Awareness Month. Rounding out our conversation tonight via Zoom is Amy Poole, who is a lupus awareness activist. Amy, thank you so much for joining us tonight. It's great to have you.
It's a pleasure to be here.
Now, Amy, you are also a person living with lupus, so we'd like to hear about your experience. When were you diagnosed and how are you doing now?
I was diagnosed when I was 10, and it's been a long road. I've had lupus for over almost 35 years, and I've had some bad times after my son was born and a little while after that. But right now, my lupus is pretty stable, kind of like Maddie's. There are good days and bad days, but I would say it's well controlled as long as I stay on my medication. I still have problems with joint pain and fatigue, and photosensitivity and muscle pain, but I don't have any serious organ involvement right now, which I'm grateful for.
Yeah, that's good news. Now, there are a number of symptoms that are associated with lupus, like some of the ones that you mentioned. What do you recommend to people who think that they may be suffering from lupus in order to get diagnosed?
You know, I've heard the statistic that many people go to 4 or 5 doctors before they're diagnosed. And I was very lucky because even as a child, I was diagnosed when I went to by the first doctor I saw. The best advice I can give to someone is to see a good primary care physician and keep copies of their medical records if they're not happy with the doctors that they have. So if they have to go to many different providers, when they're able to put the pieces of the mystery together, they have all the pieces that they can take to their provider to help them figure out the mystery. Not to be provocative, but just to be proactive in their own health care.
Some really helpful tips there. Let's talk about the Social Butterflies group. What is it and what does it do?
The Social Butterflies group is a support group. We have one in Utah County specifically that meets every second Thursday of the month, and we have between 6 and 20 people that come. We have people with lupus and people who love people with lupus, and we get together, we talk about what it's like to live with lupus, our families, our activities, our jobs, and we support each other in having lupus. We're all at different parts of our journeys. Some of us are 20 and some of us are not 20 anymore, but we meet and support each other. We also have support groups set up to meet in the Salt Lake area and the Layton area and the St. George area, but they're not operating right now because they stopped after the pandemic. But we've been going every second Thursday straight since 2016 in Utah County.
Yeah, that sense of community is so important. Hopefully it can kick back up a little bit more now that the pandemic is easing up. Now, you are looking to form a new Utah nonprofit for people living with lupus. Where are you with that process and what do you need to make it happen?
So we're really excited about this. The LFA chapter in Utah was disbanded a few years ago, and so we're looking to start an organization to fill its place with outreach in terms of information and supporting, so we can have things like walks and other things like that. We have the paperwork all filled out for our 501(c)(3) status, but what we need are people to volunteer to be on the board. As you've heard, lupus patients suffer a lot with fatigue, and we have 2 lupus patients already on the board. We need people who love lupus patients who might not have lupus to fill some of the more time-intensive positions, like treasurer or volunteer to do our accounting, or just to serve on the board to help us out, to fill in some of the needs that we may not always have the energy to do.
Wow, Amy, I'm just so I guess baffled to hear that there needs more community and support for Utahns living with lupus. I know 2 who are living with lupus, and I had no idea that it could be so hard to, find community and support. And so I really admire what you do. What would you like people to know the most about lupus? Maybe something we haven't discussed tonight, or what is something that you want our viewers at home to know as they're learning about this condition?
I want them to know that there are allies out there for them to reach out to if they need help. Sometimes when you're suffering from lupus, it's hard to leave your house, or it's hard to leave sometimes it's even hard to get out of bed. But we have a strong support group online in the Social Butterflies of Utah County or in Utah. It's a Facebook group. And even if you don't have the energy to reach out online, you can just know that there are people working for you. My husband does lupus research. It's a small lab at BYU, but he's working to do lupus research. There are people in Social Butterflies that are working for lupus outreach and working to do good things so that you have better access to information or better access to the things that you need. And so even if you feel like you're alone, there are people out there who are with you and who you can reach out to and will be there for you if you need it.
Well said. All right, you've been hearing from Amy, pool activist and someone who is living with lupus. Amy, thank you so much for joining us tonight. We wish you the best of luck on your endeavors with the nonprofit.
Thank you, Rosie.